And it means most health services are provided by private hospitals. And the role of the government is very limited from the Medicaid program because it covers only for the elderly over age 65 years, low income and disabled persons. In UK, it introduced national health services as a single publicly funded. So if you see the table, tax is the main source of financing, over 80%. The government stresses universal access and manages the source of health care funding. And there is a gatekeeping system to steer patient demand that they introduce general practitioners as a primary fund holders. So patients are required to register with a general GP and needed GP's referral to access specialists. And UK government controls the predominantly private health resources, so the role of the state is relatively extensive, strong, and detailed. Let's see the German. This German has introduced user choice for basic insurance coverage or strength competition across insurer. The ratio of public expenditure is 76%, which is higher than that of OECD average. At the same time, there are multiple private insurance like market mechanisms. And actually, principle of the state is not responsible for financing healthcare for healthcare, so role of the government over the private sector is limited and they is like a general regular. Next, Korea. In South Korea, health financing made based on the national health insurance finance supplemented out of general tax finance government revenue. Users have a freedom in choosing among primary care physicians, and because there is no gatekeeping systems. Next is the institutional arrangement healthcare system and their performance. If you see the table, infant mortality rate in US is 6.7, that is relatively higher than other OECD countries, and cancer market mortality is the highest in UK. As this indicator shows, the US and UK's output of the healthcare system is ineffective than the other OECD countries. However, we cannot make a conclusion which country and which institutional arrangement is better to increase the quality of healthcare. However, from this result, US based on its social health insurance and UK are relatively low effectiveness in performance of healthcare services. So we can see the performance is nothing to do with whether tax-based or private resources. When we see the relationship between institutional arrangement and efficiency, we can compare these countries' healthcare performance and focus on efficiency, accessibility, responsibilities. As I mentioned before, healthcare coverage promotes access to medical goods and services, providing financial security. These are the results of the paper. Last one is accessibility and responsibility. As you can see the result, there is relatively low unmet column, low unmet healthcare needs UK regardless income level. However, in US, the people who are in low income level have difficulty to access the healthcare services. We can think this result. What is the main factor? UK has full responsibility to provide healthcare services. What is the reason for gatekeeping system, regulation of the price? To do this, study is not find causal relationship between institutional arrangement and performance, but to find a way. How can we have to consider some parts of performance improved from other countries' institutional arrangement? Thank you.
Hello. Could you summarize the major findings of your research?
There are so many factors influence of the healthcare system of its performance, but we cannot make a conclusion which institution and policy is good or better, because some research are made by institutional reasons. So this is the reason we did this study, and we will try to find the causal relationship later.
You mean there's, in terms of institutional arrangements, that there is no one best way?
Yeah.
There's many ways. Okay, thank you. Now I would like to open to the floor for provide Ms. Taeyong Hun questions. The questions asked about 10 minutes. Anyone? Questions? It's crowded here. You have a question? Yeah.
Thanks, Ms. Kong, for your presentation. My name is Amboku Theophilos. I'm with the Graduate School of Public Administration at NIDA. My question relates to the countries that you used in your research. In your presentation, you limited it to 4 countries, but in your abstract, you had 6. We have the US, Germany, Sweden, Australia, Japan, and South Korea. Then in your presentation, you limited us to the US, UK, Germany, and Korea. Is there a reason for that, and why the 4 you're using right now?
I focused on these 4 countries because, as I explained, these systems are well known for explaining the healthcare system. And the 4 countries are best example of each system. So this is why I choose that countries. And I try to say this country, US if UK has a good performance, some parts like such as accessibility. This is this system's research. These 4 countries are best example of this 4 systems. So I try to explain each system has what the institutional arrangements and their performance.
You mean South Korea and Taiwan do not fit in this OECD typology?
No, OECD typology is just three, but South Korea and Germany. They include South Korea and Germany in SHI, but these two countries have unique some parts. These two countries achieved universal coverage without paying social inefficiency, and they have a single payer system, not multi-provider. Single payer system, intermediate financing, and different modes of government intervention comparing the journals. So we introduced a new model called the National Health Insurance to explain South Korea and Taiwan's new picture. This is another paper. Yeah, written on 2000.
Any other questions? Yes.
I am Shafiqul Alam from Bangladesh. Thank you for your very beautiful and excellent presentation. My question is about your hypothesis, the study, and I want to know what are the findings of your study which are new and innovative. What are the findings of your study which are new and innovative? Which are new. We are talking about innovations. What new things do you have in your findings? Thank you very much.
You mean what is implementing?
What are the innovations in your study? What new things you are getting from this study?
This hypothesis institutional arrangements to find these papers. They try to not to find a causal relationship between the institutional arrangement and performance, but to find their relationship, so not correlation. Because and then from this result, we can compare which system have a good performance. Some parts, what such as effectiveness. UK has a good responsiveness, relatively high than compared to other countries. Then we have what is the reason and the factor influence on this result? How about gatekeeping system or regulation of the price, strong government role, extensive strong government? You can think other so many thinking about this and our paper is not finished yet.
Am I correct to say that your paper is a general comparison of the performance and an outline of the institutional arrangements, public health in each country, but you haven't yet shown the relationship between institutional arrangement and performance, which that will be your next research.
Next research is to find the
causal relation with institutional arrangements and performance. Okay, how many?
Doing panel evaluation.
Okay, One last question.